Hello, my name is Monique Nowling, and I'm your host for today's episode of Our Ventura TV. In our guest studio today, we have Susan Guffee, Clinical Services Program Manager for the Ventura County Area Agency on Aging, and she's here to talk about the various case management programs at VCAAA and how they can be of benefit to older adults and people with disabilities. Susan, thank you for being here and welcome.
Thank you. Thank you for having me here today.
So can we begin with you providing us with a brief explanation of what a case management program is?
Sure, of course. So VCAAA offers several different types of care management programs, and really what case management is, in a nutshell, is an opportunity for those particular participants to work with trained staff at VCAAA or wherever that care management program would be housed, and really get more information about resources and supportive services that would be available to them, either within that program or outside in additional programs outside of VCAAA. And really what care management is designed to do is be that helping hand to help folks lead their best life possible.
And I hear you say care management. What's the difference between case management and care management, or is it the same?
It's the same. Okay. So case management or care management, it's really just verbiage and same type of programs.
Now, there are various types of case management programs at VCAAA, MSSP, HCBA. Can you explain the acronyms and the differences between the programs? And I'll start with VCAAA. That's the Ventura County Area Agency on Aging, but take it away from there.
Yes, that is a mouthful in and of itself. So VCAAA does offer really a wide range of care management or case management programs, and we do that on purpose. So that is a wonderful opportunity for folks, no matter what resources or types of needs are bringing them into VCAAA, to really find a program that's going to fit them and the different qualifications that are bringing them to that program. So it really helps us meet the needs of a pretty diverse county here in Ventura County. A couple of the ones that you mentioned, the first one you mentioned is MSSP, also an acronym for Multi-Purpose Senior Services Program. So essentially that program is designed for folks that are 65 years of age or older, and it's designed to keep them safely in their home or a community setting of their choice, as opposed to or in lieu of going to maybe a skilled nursing facility or another type of facility of that nature. So it's designed for folks who want to stay more independent in their home or in the community and just need some additional assistance. The other one that you mentioned, our HCBA program, that one stands for Home and Community-Based Alternatives Program. That one is designed to do a similar type of service. So it really is still designed to keep folks safe at home or in the community setting, but that's really targeted for folks that have more severe medical issues as opposed to a specific age range. So it doesn't matter if you're 65 or if you're 3 months old and you're coming out of the hospital for the first time in your life, this particular program can still serve you.
So not just for older adults?
No. So VCAAA, I know it says aging. It should have disability in there somewhere too, because really it's for folks that are aging and folks that are experiencing some type of disability. We also have another program, the ADRD,
another acronym,
and that one stands for Alzheimer's disease or related dementia, or really folks that are just struggling with memory impairment and live alone in the community. So that's really designed, that particular care management program is designed for folks who are struggling with some type of memory impairment and live alone. And a lot of times those are the folks that are the most vulnerable and really aren't going to access or know the services that are available in the community. So we're really trying to focus and reach out to those particular folks with that program too.
And if I could clarify for the audience, you say live alone. If I live alone but have a caregiver, would I still qualify for that program, or can I have no natural supports whatsoever?
So thank you. That is an important clarification. So we actually work with the Independent Living Resource Center as well, and we kind of run concurrent programs. For the VCAAA, our folks do tend to live alone. They can still have a care system. They just mostly live alone. They might have a daughter or a relative that stays with them every once in a while, or even most of the week, and that's still okay. And then the Independent Living Resource Center, they are focused on folks that don't necessarily live alone, but are struggling with a memory impairment and some form of a disability.
And if I'm interested in these case or care management programs, how do I find out if I qualify or if my loved one qualifies?
Give us a call. That is the best way, honestly. So we have a lot of information on our website at vcAAA.org, but really the best way to find out about all the different types of care management programs, as well as additional resources and things in our community that might be available depending on the need that you're calling about, is really to just give us a call.
Okay.
So if you call our main line, they'll be able to really navigate and help you find what's available.
And they will tell me what documentation I need to provide, depending on the program, what I would need to provide the worker?
Yes, definitely. And honestly, it's fairly simple. It's really just a referral form or an application form depending on what care management program they're interested in. Most of those are up on our website. If you're wanting to go on and just print it out, it's a very simple process. You can also call and we'll email it to you, or you can pick a hard copy up in the office too. You can self-refer, so if you're looking through these programs or hearing about some of them and are interested, you can go ahead and fill that out for yourself. You can also fill that out for a loved one. If you're a physician, you can fill it out for a patient. If you're a clinician, a client, things like that.
And I said the word worker earlier, which begs the question of what type of staff will I be working with? Nurses, social workers, who might I interact with as a client?
Yes, definitely both. So our care management programs are definitely designed to include a multidisciplinary team. And what that really means is you'll be seeing someone who is a trained social worker as well as a registered nurse. A few of our programs you'll see, you won't necessarily see that registered nurse, but a majority of our programs you will. And that ranges from a bachelor's level or a master's level trained social worker or other social workers, as well as that nurse that is a registered nurse.
And you mentioned team. If I do have a caregiver support system in place or my family, can they be part of that team?
Definitely. So it's never just the client. So when we meet with someone, some of the first things that we do are we reach out to neighbors, caregivers, husbands, wives, spouses, you know, all the whole support network, really, because a majority of these folks are either going to already have their support network in place, or we're going to help them build that so they can really maintain their livelihood in the community safely. So they're a huge part of that. And oftentimes those folks might experience things like burnout or need some education or need some additional resources and support too. So we're definitely there to guide them during that process as well. It's not just what can we do for the specific participant, it's really what can we do for you and your whole support network as well.
That's interesting. And I know you talk about goals on a global level, but can you give the audience an example of what a goal would be for an individual client? What does that mean? How does that translate into like living room language, if you will?
Of course. So one of the first things we do is create a care plan. And that's really just a piece of paper that says, what do you want to work on? And that includes all of those goals. So oftentimes someone's goal might be, you know, I need to get to my primary care physician. I need to see my doctor on a monthly basis, but I just can't get there. You know, my caregiver can't drive me all the time, or I'm experiencing these issues. That's going to go into your care plan as how can we either navigate public transit or some other form of transportation, or provide it payment-wise ourselves to try to get you to your routine appointments. Because the whole basis of the program is to keep you safe at home. And if you're not seeing your doctor or you're not getting to these appointments, then we're not really doing that to the best of our ability. So that would be an example of one of the more common goals.
And I like that you said, what would I want as a client be the goal? Now, what if I, as a client, I don't know what my goals are? I'm not really sure. Could you provide some guidance? Would your team provide me guidance in that area?
Yes, so it's really a conversation. So when we first sit down and meet with someone, what we would call an assessment or an intake, it's our very first home visit. It's in your home or wherever you're residing in that time frame when we first meet you. And it's really a conversation on where are you right now and where do you want to be. If there's certain things that are holding you back, certain barriers, certain roadblocks to making sure that you can can live independently, if you need an additional caregiver, or you need transportation, or you need help with medication management, things like that. Those are all things that we're going to be taking note of during that conversation. And throughout and during the end, we're going to sort of reflect back and say, well, I'm hearing you say, these are some of the things that you're struggling with. Here's some of the things that we have to help you, some additional resources that we have either in our program or just out in the community that can really make that an easier transition and better for you in your life.
That's wonderful. Well, Susan, we're about out of time. If there's one thing you can impress upon the viewers, what would that one thing be?
So I would say just in general, isolation is not your friend. So there's always a resource or a referral or some type of education or program out there that no matter if you're feeling just a little bit lonely, or if you're feeling like, you know what, I do need help getting to the doctor, or I just need a friendly voice when I'm feeling a little down, then reach out. And even if that's just a call to our regular, main line to just say, hey, here's what's going on, we can always sort of guide and give those resources and give out that education and information to keep people connected to their community, connected in whatever way they want to be connected, to really avoid that type of isolation. That would probably be my main suggestion.
I like that. Can you remind the viewers how to get in touch with you? I know you mentioned the website earlier. If you could repeat that website and the phone number as well.
Yes, of course.
Please.
So our website is just www.vcaa.org. So VCAAA.org. And then our main line is 805-477-7300.
Well, that's all the time we have left for today's show. I want to thank Susan again for her time today and giving us this wonderful, valuable information. My name is Monique Nowling, and until next time, thanks for watching Our Ventura TV.